Hello guys, welcome back to my channel. And in this video, I will be discussing the second part of valvular diseases. My name is Abhay. Let's begin. Okay, aortic regurgitation. So causes are the isolated aortic root dilatation, which is the most common cause. Okay, so you might imagine that if there is this disorder, the valve will not open. Sorry, it will not close properly. Okay, so the blood which was supposed to go into the aorta, it comes back into the left ventricle. Okay, causing the volume overload on the left ventricle and 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 eccentric hypertrophy. Okay. Um, Other causes are the aortic dissection, syphilis, and the infective endocarditis. Okay, and the clinical presentation of this disorder is that we get increased pulse pressure. So, uh, which is also called as water hammer pulse. Okay. Now, in order to understand this concept, we should first, discuss some terms. So, pulse pressure. So, pulse pressure is basically the difference between the systolic and the diastolic blood pressure. Okay. So, and what is the stroke volume? Stroke volume is basically the volume of blood pumped by the heart in one beat. Okay, and it is always fixed under normal condition. Now, let us hypothesize that the heart it pumps 100 ml of blood in one cycle. Okay, so 100 ml of blood is being pumped by the heart in one cycle. Okay, now in this disorder, what happens is that the out of 100, only 70 ml of blood is being pumped by the heart. Okay, and the remaining 30 ml of blood is again coming back into the left ventricle. Okay, so you imagine that in one cycle this happens. Okay, in next cycle what will happen, that the blood in which is supposed to be pushed by the heart will be 130, right? Why 130? Because 100 minus 70 is equal to 30. Okay, so yeah, so this will cause volume overload on the left ventricle and causing the eccentric hypertrophy and and finally left ventricle failure. Okay, the treatment for this disease is valve replacement after left ventricular dysfunction develops. Mitral valve prolapse. It is a ballooning of the mitral valve into the left atrium during systole. Okay. It occurs due to myxoid degeneration of valve, making it floppy. Okay. So so coming to the diagram, this is the normal heart, normal anatomy. Okay. And this is the mitral valve. As you can see that the valve during systole it balloons into the left atrium. Okay, this is the valve. Okay, so that's why we call it as a floppy valve syndrome. Okay, and the most common etiologies are the Marfan syndrome and the ALS Danlos syndrome. Okay, these two syndromes are the disorders of the connective tissue. Okay, now the presentation is mostly a symptomatic uh, mid systolic click followed by regurgitation murmur. Okay, so you should know this mid systolic click followed by the regurgitation murmur. Okay, and the murmur is softened with squatting. Okay, squatting basically increases the resistance and also decreases the left ventricular emptying. Okay, so complications rare but infective endocarditis, arrhythmia, and severe mitral regurg. Okay, as the valve is going into the left atrium during systole, the blood will come into the left atrium during systole, causing the mitral valve regurgitation. Okay, and the treatment is the valve replacement. Now switching gears, mitral regurgitation. This is basically a complication of the mitral prolapse, and it is caused by the left ventricular dilatation, infective endocarditis, acute traumatic fever, vegetation on valve edge prevent smooth closing, and papillary muscle rupture after myocardial infarction. Okay. So these are the causes of the mitral regurgitation. So presentation of this disorder is the hollow systolic blowing murmur. Okay, and it gets lower when squatting. Now, when we squat, there is increased systemic resistance, and which decreases left ventricle emptying and expiration. Now, when we expire air, it increases blood return to left ventricle and causing this murmur. Okay, and it also causes volume overload and left sided failure. So this is the last disorder which we are going to discuss. So mitral stenosis, the most common cause of this is the chronic rheumatic valve disease. Okay, and especially in this case, what happens is that there is an opening snap followed by a diastolic rumble. Actually, the murmur associated with this disorder is the diastolic rumble. Okay, and as the valve is not able to open properly. Okay, the blood which is coming from the pulmonary veins, it gets engorged. Okay, and because the blood is not moving from the pulmonary circuit, it becomes it it becomes to be filtered out in the alveolar space and causing the hemosiderin laden macrophages. Okay, which are also called as the heart failure cells. Okay, and this eventually develops into the pulmonary hypertension and eventually right sided heart failure with mural thrombus. Okay, so that concludes our discussion on this valvular disorders. Thank you for watching and remember to सब्सक्राइब कर जल्दी ठीक है।